Hey guys, it's Mary. Today we have a big video. We are going to be talking about long-term care clinicals. The reason I say this is a big video is because if your program is anything like mine, your first semester will be centered around long-term care. We had 6 to 8 different clinicals in long-term care facilities in my first semester. So it was like every week we were at a long-term care facility for like 8 hours. And so I just want to run you through my day in a long-term care clinical and kind of teach you about what to expect. So like I said, our clinicals were about 8 hours long. So we would show up at 5:45, we would shadow our person until 1 o'clock, and then we'd do post-conference with our group of students, and we would leave at 2 o'clock. So there are 3 different types of people that work in long-term care. So there are CNAs, or Certified Nursing Assistants, LPNs, licensed practical nurses, and RNs, so registered nurses. So we shadowed either one of those. We tried to split it up evenly, but we got to shadow all 3 of those types of people. And so I just wanted to go through kind of what your day will look like, what your roles are as a CNA, an LPN, or an RN. So CNAs are in charge of a couple of different patients. It'll depend on your facility and how staffed you are, but I would say about 5 patients. So you'll be in charge of going in, taking their vital signs, changing their brief in the morning, transferring them to their wheelchair, to their chair, wherever they want to be, transporting them to the dining hall, feeding them, taking them back, giving them a bed bath or a shower, and just making sure they're comfortable, putting SCDs on, toileting them at all, changing their brief again. It's a lot of work. It is dirty work. I have so much respect for the CNAs out there because I was exhausted after just 8 hours of following a CNA. It's hard. But if I'm being truthfully honest, CNAs can have such an influence on their patients' lives. They are with them the most out of anybody else. They're with them way more than the registered nurses are. And so you can determine how a patient's day can go. Again, super hard, but so much respect for those CNAs out there. So a licensed practical nurse is actually in charge of all the things that the CNA is in charge of, plus some more. So a lot of RNs and LPNs like to be like, oh, that's CNA work. Like, I don't need to change them. I don't need to shower that patient because the CNA will do that. And that's just like not the way you want to think about it. A CNA is exactly what it says, a certified nursing assistant. They're there to help the nurses get that stuff done because it's the nurse's responsibility to make sure the patient's all set up and comfortable. And so they're just there to help them out so that they can get all their work done because it would be impossible for one person to do. But like I said, registered nurses like to be like, no, that's the CNA's job. But it's not. It's really your job. They're just there to help you. So treat your CNAs with respect when you become a nurse. And pay attention, like while you're at your clinicals, pay attention to how the nurses treat the CNAs and determine if you want to be like that nurse or if you want to be a little nicer. And you will probably want to be a little nicer than them. Anyway, so an LPN throughout the day will be doing any of those hands-on skills that a nurse will. So any of the med passes, so administering medications, giving injections, changing catheters, things like that, any hands-on skills. So a registered nurse will do all the things that the CNAs, the LPNs do, plus a little bit more. And so the little bit more for a registered nurse is assessment. LPNs aren't allowed to assess, they just do what needs to be done, but a registered nurse will assess and evaluate a patient. So they'll look at their skin, any head to toe assessments, so like neurological assessments. They'll pay attention to how their bowels are doing, decide if they need to contact the doctor and get any more medications for them. So that's what a registered nurse has to do on top of all the LPN roles and on top of the CNA roles. So if you're following a registered nurse for the day, at 5:45 you'll go to something called Huddle or rounds. And that's when you meet up with the night nurse and you go through each patient and just get an update on them. So if they fell through the night or the day before, if they were hospitalized, if they're having trouble with like constipation or something, they'll go over that. And also if they have any appointments that day that they need to be transported to. So Huddle's really important because you'll get to see what you need to pay attention to the most that day on your shift. A big thing that we had to do at long-term care facilities was care plans. And so that's where we interviewed patients and did an assessment on them, and then you have to go into the chart and write down all their meds and their lab values and stuff like that. And so my tip for care plans for first semester is to write down literally everything, because you don't know exactly what you need or how specific your professor wants it. And if you leave the facility, you can't go back and get that information. So write down every little thing. So not just the name of the medication, how much they take, what time they take it, how often they take it, things like that, because you just won't know what you need later. My general tips for long-term care, I have 2 of them. The first one is not to wear an undershirt under your scrubs. So if it's cold outside, I'll usually put a long sleeve under my scrub top. You don't want to do that at a long-term care facility, because the residents keep their rooms so hot, and you're trying to turn them and move them, and you're just sweating because it's 80 degrees in there. So my tip is to not wear an undershirt. I promise you'll warm up. My second tip is to not be afraid to be loud. Those patients can't hear anything, and it's weird to be screaming at someone at 6 a.m. or 7 a.m., but they literally can't hear you. So don't be afraid to be yelling at them. It seems very, very weird, but it's necessary. I hope this video prepares you guys a little bit more for your long-term care clinicals. I know I didn't know what I was doing, but just follow your nurse, learn as much as you can. Don't be afraid to ask questions. I hope you guys have some great clinicals this week, and I will see you next time. Bye.